worked here for 20 years, and when I first met it, it was a small district general hospital, really starved for resources. It's extraordinary the growth that's been happening here in the last few years. The new clinical services building opened less than 12 months ago. There's a new acute services building, emergency department, ICU, operating theatres, delivery suites being built at the moment to be open within the next 18 months. The rate of growth of this service is quite phenomenal, and within a few years it's going to be one of the 4 or 5 biggest and busiest hospitals in the state. This hospital has virtually every medical specialty across the board, with a couple of exceptions. Within our local health district, Westmead Hospital is a very big partner and has some of the very highly specialised surgical programs, and we do not duplicate those here at Blacktown. A JMO or a basic physician or surgical trainee at our hospital is much more likely to have their hands involved in managing an interesting case just because they're the key team members. You learn from seeing really interesting patients and being involved in their management on a day-to-day basis. Teaching is what we want to do well around here, and that it means a lot to us to develop our young staff in that way. But one of the universal things is a very high sort of patient load, so we see a lot of patients here. Now that means that if you're working at Blacktown and Mount Druitt, you're going to be busy, but you're going to be seeing an enormous amount of sort of interesting clinical material, and that's primarily where young doctors learn most. There's really nothing that you can't do or be exposed to if you're working with us as a JMO. Young doctors who come to work with us, young students and training nurses who come here are going to see an enormous amount of work, and most importantly there's going to be a lot of opportunity for new positions to develop here in coming years. So it's perhaps a place to grow your career well beyond your JMO years.